Hey loves, Roseanne Austin here with a very special presentation of the Fearlessly Fertile podcast. We're going to be talking about pelvic visceral manipulation with my friend, Dr. Jenny Mercier. I am so excited to be presenting this to you because if you're struggling with pelvic pain, you want to increase blood flow, and you want to give yourself an improved chance for your treatments or even your natural conception to work, you have got to listen to what Jenny has to say. She's going to get into all of that stuff that, not a lot of us are talking about, not a lot of us are educated about. So if you struggle with endometriosis and they're telling you your ovaries are lazy or whatever's going on, you're going to want to tune into my conversation with Dr. Jenny. So here you go. Enjoy. Jenny, I am super excited to have you on the podcast. So let's start off with sharing with the women that are listening a little bit about who you are and exactly what you do.
Well, Roseanne, thanks for having me. This has been a long time in coming, and I really appreciate it. I appreciate you and all the work that you do as well. We both do something different, so it's really amazing to kind of share the platform with you today. I developed Mercier therapy, which is a deep pelvic organ visceral manipulation to mobilize the pelvic organs, restore blood flow to overall optimize function of the uterus, the tubes, the ovaries, and all of the surrounding structures in the pelvis, whether we're working to create healing from a past surgery or we're looking to monitor natural ovulation cycles for conception, or we're preparing for a more medically assisted cycle such as IVF, or if we've already done IVF, maybe frozen embryo transfer, even donor embryo transfer, whatever the case may be. I will prepare women to be at their most optimized health for conception, whether it be natural or medically assisted.
It's so funny, Jenny, when I hear you say that, I think back to the woman I was back when I was on my own journey. I know you had a journey as well. And if somebody told me that those parts could be manipulated, I probably would have freaked out. What? This could be manipulated? What does that even mean? So my guess is that some women, as they're hearing this, it would be awesome if you kind of broke that down a little bit. Like, what does it all mean? Like, are those parts mobile? Like, what is that? Like, yeah, I mean, I know because I follow your work, but I think it would be great to kind of give the women a sense of what this really means.
Yeah. So, I mean, all organs move, right? As you take a breath in, everything moves. And then when you exhale, everything moves. And all of the organs move against each other to optimize their own function. It's like the tree out in the front of my office. When the wind blows, the leaves blow and the leaves brush against each other. And then they create chlorophyll, and then they clean their own being, and then they clean the air and they leach toxins from the air, and everything in life moves is the point. If you're not moving, if your organs aren't moving, if you're not utilizing your joints often by engaging in physical activity, you're slowly going to become more restricted in your range of motion, right? So ovaries, uterus, the surrounding structures in the pelvis is the same way. So if a woman has had a C-section, or if a woman has had a myomectomy, or even a hysteroscopy, laparoscopy, laparotomy, and there's scar tissue tethering everything in place, we have to get in there and engage those organs so that they're moving, so that they're hearing the signaling from the pituitary and hypothalamus to make the certain hormones that they need during the cycle, so that we can be the most fruitful in our follicular phase, the most fruitful in our luteal phase, and for conception to happen. Now, if there is no surgical scar tissue there, we have to engage the mobility anyway. So if you have a shoulder dysfunction that disallows you to play pickleball and to swing that paddle, to be your most efficient, you have to have some sort of therapy or rehab on it. Or better, moreover, I should say, if there's an issue in that shoulder capsule that needs surgical attention and needs to be fixed, it gets fixed, but then we have to rehab it after surgery. We have to make sure that the mobility has been restored, the blood flow has been restored. If tissue is not fully mobilized and flushed with blood, we can have something called tissue damage or necrosis. And everything kind of freezes up in space there, and it doesn't work as intended. So getting in there with my hands through the abdomen, the lower pelvis, and manipulating organs the way that I do in a sequence called Mercier therapy has proven over the last 25 years to be something quite amazing with helping remove pelvic pain and help women get pregnant without using drugs and surgery. It's been awesome.
Yeah, I mean, I've seen it. Well, and it's interesting to me because, having lived this, both of us having lived this, it's funny how at least this was never really spoken to me. That like, hey, nobody ever asked me, do you have much period pain or any of these things? Like it was just, okay, you're not getting pregnant. Take these drugs, do these things. And I do remember having a hysteroscopy and a hysterosalpingogram, but nobody ever told me that could potentially cause scar tissue. Nobody checked me after, any of these things. So what you're talking about is, I think, something that's extraordinarily important for women to learn more, that like, hey, maybe if you've had some of these procedures, you're going to want to consider this rehabilitation practice and this way of getting the blood flow where it needs to go. I mean, it's almost like we're not completing the loop, and what you do really completes the loop.
Right. And I always, absolutely, I liken to like what I do to this example. If you've got your garden hose running with water full speed ahead, you're watering your garden and you want to get done with it quickly, and then somebody comes along and steps on the hose, the water may trickle or the water may stop. I know this because my son does this all the time to me. And when the water stops, I'm like, oh my gosh, it's like 3,000 degrees out here. I just want to get this garden watered. Get off the hose, and he'll get off the hose and I'm able to water again. So there's a feedback loop that if the water isn't constantly, the signaling isn't constantly flowing, we've got a kink in our hose. We've got to restore the full flow. Otherwise, we're functioning maybe half or a quarter of what we're actually capable of functioning at.
Wow. That really does put it into perspective. So, and that, that causes me to think about endometriosis. I mean, we both have women that come through our practices with, that kind of diagnosis. Like, how does what you do, address things like endometriosis?
Well, Roseanne, I have stage 4 endometriosis.
I was talking to the right lady.
Yes. I was diagnosed when I was 23 with stage 4. And
and you have 2 babies.
Yeah.
So you're living proof that stage 4 does not have to be the end of the road for you.
It does not, because after my third laparoscope at 34, I was told by my friend who did my surgery, a reproductive endocrinologist, that I would have to have IVF. And I said, well, I'm not having IVF. And he's like, no, you have to. And I said, Chuck, I don't have to do anything. I'm not going to do IVF. He's like, well, I'll see you at my office. I'm like, well, I'm not doing it. I showed up at his office for my post-op. Then I showed up at his office about 6 months later and I was pregnant. I'm like, do an ultrasound. So I had my students work on me. They used my therapy on me. And I had been married before. So I was on my second marriage. My first marriage, I didn't know Mercier therapy. I didn't know what that was like. And so once I started to get creative and poke around on my own self, because I didn't want to do Lupron suppression therapy or more oral contraceptives, I started to break down some of those barriers, and I could feel my organs start to move. I could feel that there was something tangible happening. I could feel that blood flow was restored there. I was having more discharge too. And that means when you contact the ovarian surface, you send a signal to the pituitary that the pituitary says, okay, the girls are listening. Send some estrogen. Estrogen lubricates us. Estrogen thickens the endometrial lining. Estrogen makes good fertile discharge. Estrogen also supports the growth of the follicle. So I knew something was happening because I would be doing ovulation test strips prior to having any of my own work done on myself. and I wouldn't get an LH surge. Now I'm getting an LH surge and I'm like, what the heck? What happened? That's where I started to investigate further. I'm like, what? Something's going on. So let's take this a step further and write the sequence, write a manual, and then start to implement this in practice, but also start teaching it to other professionals. I did that, and that was almost 19 years ago, and we're in 22 different countries, which is such a blessing. It's very humbling for me. I do this work because it brings my heart so much joy. I wouldn't have my babies without my work. I was told you need IVF. I was staunchly told that I needed IVF. And listen, there's a reserved place and time for IVF. I'm not against IVF, but I think that we don't need to actively be decoupling couples. I think that we can couple them up and teach them what the cycle looks like so that they know the signaling in which to cover the window of opportunity by being intimate. And if we need IVF, we need it, or we need a little other help, fine. But that's how I operate in this practice. I never want to decouple a couple. And if we do have to use something more medically, I really encourage them to go to every visit together and be in it together.
Yeah. Yeah. I mean, that's what I love about you. And that's why we're birds of a feather in a sense, because I think that both of us are living examples of, hey, wait a minute, there's something else going on here. And it's really easy to be written off by, allopathic medicine as helpless and hopeless. I mean, most people, when they hear stage 4 endometriosis in your case, or in my case, they just tell you you're freaking old, right? We get written off. Like, okay, we're going to toss those old biddies over. This one's helpless, this one's old. And it's just kind of like, wait a second. If we have a desire in our heart, there's going to be a way shown. And what I love about your work is really encouraging women to get back in touch. I love how you were talking about the signaling, because I think that's exactly what starts to happen. I mean, before we conceived our son, there was just something in me that said, it's time, which made no sense, Jenny, because I was already in my 40s and I had a shady fertility treatment pass behind me. I was shady. And it didn't make any sense. I mean, so we're both living examples, both through our work and through the families that we've produced, to show that, hey, when somebody tells you this is your only option, that's a big, beautiful red flag to say, wait a minute, I think you might want to look at some other things. So, and I have, and this actually brings to mind one of my dearest clients, because somebody, is always out there saying, well, you don't have enough eggs. You've got stage 4 endometriosis. If IVF won't work for you, nothing will. So it sounds to me like when women start bringing the flow back and when they have the movement in their ovaries, their pituitary can work, send the signaling, you start to notice your body, working again. Like, my guess is you've probably seen this thousands of times. You've probably seen this all over your practice, women being told that they couldn't conceive who ultimately do.
Yeah. Oh, yeah. Lots of them. I also see a lot of women that have already failed multiple IVF and FET attempts. And I always want to impress upon women that if you have a history of miscarriage, IVF does not prevent miscarriage.
Well, even PGT testing.
Yeah.
Like, everyone thinks that, okay, if I do IVF, I do the testing, I can prevent all of that stuff. That's not exactly true.
It's not, because you can have an embryo come back as a mosaic or undetermined, and they just can't tell you what's up with the embryo, and then they discard it, and it might be okay. But when we create babies at the hands of humans and we use technology that humans have created, and we're not relying on what the creator gave us to make our babies, we can get a little too far into the sci-fi part. And I think that's where we fail miserably. We don't need to be engaging so many procedures. I mean, if you're going to transfer an embryo and it's not compatible with life, it's probably not going to thrive, and you will have a miscarriage. Or you've got a baby that's growing in there that isn't compatible with life. That baby still has an opportunity to grow, and you have an ability to give birth to that baby, meet that baby. Maybe that baby does defy the odds and he or she lives. So we are just taking it a little too far when we're doing gender selection, when we're doing ICSI. ICSI, for those of you who don't know, it's intracytoplasmic sperm injection. So that's an embryologist. You're going to cut this out, right, Roseanne?
Yeah, I can, if you want me to.
Yeah. So ICSI is when an embryologist takes a sperm, the sperm that he or she chooses, and forces it into the egg. And now we've got a baby made at the hand of a human, because with a regular, gentle, natural conception, even can be in a natural IVF, we've got the egg waiting for the sperm. And then we unleash the sperm, and then they race toward the egg, and then the egg communicates with the sperm. And the egg says, okay, you can come in. And then all of the other sperm are left there and continue to communicate with the sperm that has fertilized the egg. They're giving it instructions on what to do. And then further, that embryo goes down into the uterus and implants itself. There's another communication. There's communication between the endometrium and the embryo. And I think if we monkey around too much with the whole communication process, there's something that's lost there. Because I think that natural selection, where that very primal communication between the egg and the sperm happen, and we take that out of the mix, something there, I think, happens. And I can't pinpoint it exactly. But, Roseanne, like as women and as faithful believers, we've got that spidey sense, right? That kind of like intuitive spidey sense that just says, maybe we shouldn't do that. Right? Maybe we shouldn't do that. And couples can ask, if they're going to do IVF, they can ask their fertility clinic, hey, can you just set the egg in the dish with the sperm and allow for, biology to take its course? And yes, they can do that. They don't have to do ICSI. Now, there are cases where the urologist has to go in and retrieve a sperm via testicular extraction and then force it into the egg. Otherwise, this couple's not going to have a baby. I have couples like that right now. Okay, there's a time and place, but pray about it. Pray about that scenario. Don't just let it unfold as if you were being left out of the scenario. But there's a time and place for everything. And I think if we can really consult our creator on what we're going to do and what's the best next step, we're going to be all the better for it. I have a faith-based practice. Like I pray before every patient. I pray over my room. I pray over my treatment bed. Like, we have to bring Holy Spirit in here every single day, because it's not me. It's me doing the work through him. So
I think that's beautiful, Jenny. And, and our words have power.
They do.
Right? We're either speaking life over the things that we want to bring in our lives. And if people feel guided to certain things, okay, that's what they're hearing. And it's fascinating to me to hear about, women who have been told, like, okay, you can't do this, you can't do that, and there's no hope for you. But I just had a woman that was on my podcast 2 weeks ago, pregnant naturally at 47. It's crazy.
Amazing.
It's crazy what happens when we get out of our own way and we start looking, I think, and getting to know ourselves even better, both physically, right, and mentally.
Oh, I agree.
Well, and so when you go in to do your therapies, and you do them in your office, and then you have practitioners all over the world that are trained in this work, it would be awesome if you would just kind of give a sense of, like, when you're starting with someone, what are some of the things that you look for?
Starting with a patient?
Mm-hmm. Mm-hmm.
Yeah, I just look at like their history, what they've been through, what kind of testing have they had prior to coming to me. Some have none. Some have no trust in the medical system whatsoever, and some have done nothing. Some have done the full reproductive endocrinology workup. So I look at their past. I look at any surgical reports. I talk to them about lifestyle. If they're using THC, alcohol, tobacco, vapes, any of that kind of thing, we talk about it. We talk about just, general lifestyle stuff is what I want to know about people. I look for commitment. How committed is somebody to embracing this thought of like, I can get pregnant. I can get pregnant. It's not something too far-fetched. It's something that is completely within their reality, but they've been told otherwise. I have reproductive endocrinologists that tell patients, if you do IVF and you have a history of RPL, recurrent pregnancy loss, if we do IVF, we can genetically test the embryo and you would have a 75% chance of pregnancy with IVF. And I'm like, where did they get that number? Because so I just directed a woman to SART.org yesterday, the Society of Assisted Reproductive Technology.org, where all of the numbers from nationwide clinics that participate are located. No IVF clinic has a 75% success rate. That's otherworldly, honestly, right? I mean, that's like, so I don't know. I hear this all the time where these numbers are just pulled out of thin air to just make the clinic look better. And I think that's really deceptive practice.
Well, I think it's also interesting because I think you bring up a good point, is that I think when people are looking outside of themselves
Yeah.
for authority,
Yeah.
instead of being their own authority,
Yeah.
and checking in with themselves, does that sound right to me? Does this sound correct to me? Does this line up with my values? We get off into the weeds with the statistics because people start to say, well, this clinic has this statistic, that clinic has another. And it's like, wait a second, it's either you're going to get pregnant or not. Like, that's the only thing. Like,
what is it? What is the, right. I mean,
it's like, and then women torture themselves. Like, I was only given a 20% chance. But it's like, I think the number is you only have a 20% chance of getting pregnant at any given time, right? Even young women have,
100%.
So it's just, I think that women have been manipulated out of their own power when it comes to something that we were given by the creator, to have babies, right? Like, don't allow other people to put their fear and their worries, and certainly the statistics that are paid for by big pharma and, things like that. Like, don't let those things scare you. I mean, I'm sure that you've seen this in your practice as well. There's tons of women out there getting pregnant who were told that they couldn't, but nobody reports on them.
Yeah. Right. Well, there's no money to be made in that, Roseanne.
Yeah. Well, so it's interesting to me, especially when, your practice is all about empowering women to get to know their bodies. They get treatment from you. And so what happens after do you do in your office treatments and then people go home with a care program, or do they have to come back to see you? Like, give us a sense of how that works.
Yeah. So the Shared Journey Fertility Program is a year.
Great.
Yeah, it's 6 1-hour treatment sessions concurrently, as close as we can get them. Like I like to say once a week. I do have patients that come from all over the place, so we can do all of the treatment, which is 6 hours. We can do that in 4 days if they're flying in to see me. But for local patients, I'll do every week. Or for patients that need Saturdays, it's every other week because I'm only here every other Saturday. And then when they get to the 6th session, I have a plan made for them. It's a hormone and supplement protocol for them. It's drop shipped to their house. I give them a journal that I created. It's very, very easy to use. And I have them monitoring their cycles with the clear blue strips. I tell them exactly when they should be coupling up with their husband or partner and let them know that in 3 months, if you don't have a positive pregnancy test, I want you to come back in with your journal. We want to look at that 3 cycles worth of data together, look for consistencies, inconsistencies, talk about it. Maybe I make a change to your protocol. Maybe I leave it alone, but I'll do a little bit of work on you. And then we'll meet up every month thereafter.
That's
just to
great.
see how everybody's doing, checking in. And my patients know that I'm available to them as well. I mean, most of them have my cell phone, and they're welcome to like just send a little, hey, I got a positive on my strip today, or here's my positive pregnancy test. And it never ceases to amaze me, this work, and how
Yeah.
women handle themselves so well when they're empowered to recognize their own signaling. It's so good.
I think that's one of the biggest points that I think is salient here is this whole idea that you become very familiar with your own signaling and you get to know you and you get to know your body. I mean, the point that I made at the very beginning was both in jest, but it was also reality that so many of us are so disconnected from our bodies
Yeah.
that, like, I mean, I knew a lot about the female body because I was a sexual assault prosecutor, but I knew nothing about it within the context of me. And I think what you do changes the game because when a lot of women go in fearful into a doctor's office and don't know nothing, they don't know anything about their structures, why they might move, why they might be stuck,
Right.
how they might recognize symptoms of lack of blood flow, or if there's impingements or there's other things. I don't even know I went to law school. I don't know all the terms, but like, there are probably a lot of things that you can tell as a professional really quickly about people. And I think it's great what you're doing. Is there a particular condition that you find yourself drawn to the most?
Yeah. Drawn to, yes, endometriosis for sure. But I
Mhm.
do see a lot of polycystic ovarian syndrome.
Oh, so how is that different for you as a practitioner?
So I would change up a protocol, not Mercier therapy because it's always the same for every woman, but their protocol as far as supplementation and hormones.
Mm,
And then sometimes it can be tricky to monitor cycles with a woman that has PCO or
mhm,
PCOS, but we do our best. I do
mhm.
my best to calibrate them, try to get them less cystic. And mostly it comes from diet because this is a pre-diabetic condition.
Mm,
So if
mhm.
you're eating crappy, and you've got a lot of sugar on board and you're not moving around and you've got like this big pendulous belly, that's not helping you. So I do recommend a lot of lifestyle changes. And, to be completely honest, I'll make them very simple lifestyle changes because we have to think about compliance.
Mhm.
Like, are they going to comply with, no gluten, no dairy, no this, no that, the other? But if you work with me, I treat you like you're pregnant the minute you walk in my door.
Mm. Oh,
So,
that is a paradigm shift in and of itself, Jenny, is to be treated like that and not like a pariah. I mean,
right.
well, and I think that this is kind of, I mean, what you're doing, what I do, what
Yeah.
some of the other leaders in the industry are doing is I'm already seeing a lot of shifts away from the hyper medicalized
I am too. Yeah.
cycles. I mean, and I think that people are tired of that. And I think they're tired of the constraints that praying at the altar of allopathic medicine does. It creates this idea that if we can't help you, nobody can. But that's a big fat lie. You're proof
Totally.
of that. I'm proof of that.
Yeah.
The people that we serve are proof of that. So I think that, it's a really interesting time in our country and in history for women to be coming back to their own sense of power and, familiarizing themselves with, some basic common sense about discernment, but also empowering themselves by finding practitioners that have expertise like yours that prove that, medicine is fantastic for what it does, but it's one piece of the puzzle.
Just one.
Just one, just one. So thank you, Jenny, so much for coming on. And what are the best ways? We're going to obviously link to your website, link to your social in the show notes. But it would be great to hear from you how you would prefer to be contacted for the women all over the world that listen to this podcast that are going to be banging down your door.
Sure, sure. Happy to help anyone who reaches out. To schedule, we schedule by email only. Otherwise, we'd be so bogged down taking phone calls. So if you just bear with us, Mercier Therapy, so MERCIER Therapy, THERAPY @gmail.com. Best way to reach out, best way to schedule. And then, yeah, you can follow me on Instagram. I'm always putting up pearls of wisdom there. If there's something you want me to talk about, send me a message. I'm happy to I'm going to research it if I don't know anything about it, because I'm never going to just tell you I know something about everything. I don't. But I will find out for you if I don't know. So just let me know how I can be helpful to you, and I'll do it.
Yeah. Well, I'm excited for the ladies to get to know your work, Jenny. And one last thing I have to ask you about, because you're a fellow documentarian. You have a documentary coming out next year, right?
I do indeed.
I'm so excited.
It's going to be awesome.
Yeah, I can't wait. And we'll have you back on again to promote that as well, because I think, we're a bunch of change makers around here. And I think that the conversation about fertility, women, and everything about making babies is changing. And I love that you're out there. So thanks for coming on.
Yeah, you're welcome. Thank you for having me.
And loves, wasn't my conversation with Dr. Jenny Mercier absolutely fantastic and eye-opening? It was incredibly interesting to me. So I really do hope that you check out Dr. Jenny Mercier's work. She's very active on Instagram, and she's just a love bug. So I hope that you go down to the show notes, check out her work, check her out on Instagram, and don't you dare forget, the desire in your heart to be a mom is there because it was meant for you. See you soon.
Love this episode of the Fearlessly Fertile podcast? Subscribe now and leave an awesome review. Remember, the desire in your heart to be a mom is there because it was meant for you. When it comes to your dreams, keep saying hell yes.